Hi, I'm Dr. Dale Isaacson, Senior Physician at DC Derm Doc, specializing in non-surgical cosmetic procedures. Welcome. Thank you for joining our virtual event. Tonight we're going to introduce you to the latest line of hyaluronic acid fillers, RHA fillers, or resilient hyaluronic acid. We're also going to show you a live demonstration of how these fillers are utilized and what to expect when you come in for a filler appointment. There'll be a live question and answer session at the end of the event, so please stay tuned and submit your questions by tapping the tab on your screen. Also, please stay till the very end of the event to be eligible for our specials. We will be giving away 2 free vials of filler and our 2 most popular cosmetic products, the vitamin C brightening serum and the hyaluronic acid serum. Also, attendees will be eligible for $200 off 2 vials of filler when scheduling an appointment before the end of January. RHA fillers are the latest advancement in hyaluronic acid technology. They are the only FDA-approved filler for dynamic wrinkles and folds. They have less chemical modifications than other hyaluronic acid fillers that are out in the market, and therefore most closely resemble your own body's hyaluronic acid structure. RHA fillers are different than other hyaluronic acid fillers on the market, such as Juvederm and Restylane, in that they integrate into your skin very well and they move as your skin moves, as opposed to other hyaluronic acids that are out there that can just sit there in your skin. As opposed to other hyaluronic acid fillers on the market that can look unnatural with expression, RHA fillers are beautiful at rest and flawless in motion. We're proud to be one of the few selected practices in the area to be able to carry the RHA line. We brought the RHA line into our practice because of the desire of our patients to look natural and not fake. And by using a filler that moves as your skin moves and dynamically moves with it, we're achieving those goals for our client. In addition, the RHA line of fillers tend to last 15 months. Approximately 3 to 4 months longer than most of the other hyaluronic acid fillers that are out in the market. Another value addition to our clients. So RHA fillers come in 3 different viscosities and stretchability. RHA4 is the thickest of the RHA products, and it's good for structuring. It's good for the cheeks, for the chin, for the jawline, where you need more definition and structure. RHA3 marries strength and stretchability, so it's good for areas that move more, such as the nasolabial folds, the mesolabial folds, or the forehead. RHA2 is the thinnest and most stretchable of the products, so it's best for thinner skinned areas, such as the eyelid, the lips, for fine lines on the face, and to even out surface irregularities on the skin. So anyone is a good candidate for RHA fillers. If you want to look natural and you don't want to look fake, then this is the filler for you. Anybody from their late 20s through their 70s is a good candidate. Obviously, there's going to be different desires and different things that we're going to want to do with those fillers depending upon your decade of life, but anyone is a good candidate for RHA fillers. So you're going to see immediate results from RHA fillers. However, there can be some minor swelling, and that can take a couple weeks to go down. It's usually not very noticeable, but it may be 2 weeks before you see the final results. So the nice thing about RHA fillers is they last for approximately 15 months. That's 3 to 4 months longer than most other hyaluronic acid fillers that are out in the market. Now, there can be some variability depending upon your lifestyle. If you lose a lot of weight, then you're losing subcutaneous volume in your face. It doesn't mean that the filler has dissipated. It just means that you got more volume loss and you may need some additional fillers. If you are an avid exerciser, then you may metabolize that filler faster than someone who is not. And then it's just the simple aging process of the skin. On an average, you're losing 1 vial of filler for every year of your life starting in your 30s. So just the aging process is going to contribute to additional volume loss, even though the filler is still there. Now, I've seen some fillers that can last up to 2 years and still look good. And at 15 months, not all of the filler is gone. You still probably have about 50% of it still viable in your skin. So there's no downtime to fillers, especially the way that I perform fillers with cannulas. There can be some minor swelling. There can occasionally be some bruising, usually not. If you do get bruising, it can last sometimes up to 1 to 2 weeks. It can be covered up with makeup. We ask that people don't exercise for the remainder of the day, that they don't rub or manipulate the areas that we injected for the remainder of the day. Try to avoid aspirin, pain medications like Advil, fish oils, alcoholic beverages for the remainder of the day to reduce the chances for bleeding. We're here with Sarah. She's 42 years old and she's looking to just be refreshed. So Sarah, what is it that bothers you the most when you take a look at your face?
Right here. Okay. These creases by my nose.
Okay. Well, that is a typical response. So the nasolabial folds are what 80% of the population comes in for. But what you don't realize is that these are a symptom of something else that's going on. What's happening is as you're growing older, you're losing subcutaneous volume in your face. By that I mean you're losing bone, your skeletal frame is shrinking, you're losing fat pads in your face, and the fat pads that are left are shifting in locations because of looser ligaments in your skin. So if you take a look here in the mirror, when you were younger, you had more bone and fat up here in the cheek that held this cheekbone up. And so the focus of your cheek was up here rather down here. Now as you've aged, you lost that subcutaneous structure, so this skin has nothing to hold on to anymore, and it falls down, producing this nasolabial fold here, and the beginning of the gel that you see here. So to just fill this nasolabial fold, as many injectors would, is going to make you look a little funny because it's going to project your front portion of your face compared to your lateral portion of your face. Ideal beauty is shaped like an egg. It's wider at the top, gently sloping down to a narrower bottom. So to get rid of this, you want to go ahead and put the filler mostly up here to lift that fold up and keep this skin elevated. In some people, because of loss of bone, you can have a very deep area here, right to the side of your nose, and then we do need to fill that as well. But for most people, the majority of the nasolabial fold can be filled by lifting the cheek up and out. Now, when I take a look at your face, I see some other structural problems, which you may or may not want to go ahead and address. And these include that you're losing not only bone and fat in your cheek area, but you're also losing it up here in your forehead. You want the forehead to be a nice, gently sloping curve back to your hairline. And you're having a little depression here due to loss of bone and fat, and that's leading to some loose skin in this area, which is allowing your eyebrow to droop. So by putting a little bit of filler in here, we give back that nice youthful shape to your forehead, but we also help to elevate the brow. In addition, you're hollowing out a little bit here in your temple, and that is contributing to some of the laxity in the rest of your face. So putting a little bit more volume up here in the temple will lift that cheek up and give you better shape to your face. And you're losing a little bit of fat here in your preauricular fat pad, and that is leading to a little bit of this jowl that you're getting here, and a little bit of lack of definition to your jawline. So putting a little bit of filler in here will bring all that back. You also are losing some volume, subcutaneous volume in your chin, which is causing your chin to telescope back up into your face and form this crease. So by putting a little bit of filler in here, we can bring that chin out a little bit and give it a more youthful appearance. And for you, which is structurally how you were born, your chin comes to too acute of a point. Ideally, the chin should in a woman be about the width of your nose, and yours is a little bit narrower than that. So putting just a little bit more width to the chin will smooth that out. You know, we can just go ahead and fill the nasolabial fold, or we could go ahead and do more of a total rejuvenation to your face.
I like option B, please.
Okay. And that's what we do here at DC Derm Docs. We educate our patients. We, of course, want to go ahead and address the concerns of the patient, and some people can only afford 1 or 2 vials, and we can go ahead and give significant improvement with just 1 or 2 vials. But to go ahead and do a total facial reshaping and volumization, you know, that can take 6 or more vials of filler. When you look at celebrities on Instagram and that are in the news, and you see the before and after pictures of them, that's not just with 1 or 2 vials of filler. Most of them had 6 to 12 vials of filler. And then everybody says, "Oh my God, 6 to 12 vials of filler! Yeah, you know, you're just using way too much on me, and it's going to look unnatural." But no, 1 vial of filler is just 1 cc. A teaspoon is 5 cc's. So if 5 vials of filler is just 1 teaspoon worth of filler. So it's really not that much. And it's not how much you get, it's where you get it. And that's where the injector comes into play. Right? Because the filler is just like paint to a painter. Okay? It's really the injector that makes the difference. Now, the biggest concern for most of my patients is that they want to go ahead and look natural. They don't want to look overdone. They don't want to look like a real housewife or a caricature of themselves. And here at DC Derm Docs, that's what we specialize in. We look for a natural look. We're not going to make you look like somebody else. We're just going to make you look refreshed. Our goal is people look at you and they don't know what you had done. The one will look at you and say, "Oh, you're looking better," but not really know why. You know, did you get a haircut? Did you lose a little weight? And so we're just going to mark out some of the areas and boundaries that we want to go ahead and fill. Now I like to numb my injection ports before we actually do the injections, and that's what we're going to do now. We're going to numb the skin. It also has a little bit of epinephrine in it to constrict the blood vessels, so there's less chance for bleeding. I got a little stick, a little burn. And there's various different strengths of RHA. They come as RHA 4. This is the thickest product and the strongest product of the RHA line. And it's good for structural support. So we want to go ahead and use it where the face needs more structure. So we'll put it into the cheek area, in the chin area, along the jawline here. RHA 3 really marries strength and stretchability. It's an equal balance of both, and so it's good for areas where there is more mobility. Here in the nasolabial folds and the mesolabial folds, or here on the forehead, is a good area for the RH3. And RH2 is the thinnest of the products. And it's the most stretchable of the products, so it's good for thin-skinned areas. So it's good for filling underneath the eyes, for the lips, for fine lines, or for surface irregularities in the skin. So I like to inject with cannulas. I prefer injecting with cannulas wherever I can. Occasionally I do need to use a sharp needle. But the cannula is a long hollow metal rod with the opening at the side rather than the tip. The tip is blunt, it's not sharp at all. It can't penetrate into through the surface skin, so we do have to make a little opening for it, but it does glide through the fat layer very easily. And the nice thing about this is I can reach a lot of locations with a single entry port rather than having to go ahead and do multiple sticks. But in addition, it avoids complications. Because it is blunt, when the cannula touches a blood vessel, instead of puncturing it and leading to a bruising or causing us to inadvertently inject into that blood vessel, which can produce side effects, it pushes the blood vessel to the side, and so there's less downtime to it, less swelling, less bruising, and patients can leave without having any downtime. So I prefer the cannula. My patients prefer the cannula. Now I lift the skin up to get underneath the muscle, and open your eye for me. And you can see where the tip of my cannula is up here. Now we want to inject very little in the central cheek area here. We used to inject, years ago, large quantities in this area, and that led to the cheek looking much too full, giving what they call that pillow face on the internet, and making you look very odd. So we don't do that anymore. We concentrate a little bit more laterally, and we're just injecting very, very small quantities. And a lot of people ignore the forehead, and they overlook the temple area a lot. So forehead does tend to be a little bit more tender. You know, and all the while you're doing this, you want to go ahead and keep in mind the proper proportions of your face, because there's definitely certain ratios, and when people do cookbook formula, they're not necessarily looking at the proper ratios of the face. You know, you have to look at thirds. So, you know, 1/3 of the face, 2/3, and the other third, and make certain that they're all even. You want to make sure that the chin projects out to the proper balance with the nose. You want to make certain that the jaw angle is at the proper angle. You know, for a woman, it's like 120 degrees. For a man, it's 90 degrees. For a woman, the cheek has to be the most prominent portion of the face, while in a man, it's about equal, so that for a man, the temple and the cheeks and the jawline should all line up, but in a woman, the cheek should stand out at least 10% wider than the jawline. Sometimes women are very bottom heavy, and that may be because of an increased masseter or chewing muscle, so you may want to shrink that muscle. So it's a matter of analyzing the face and seeing what it needs. It doesn't always need filler in all these areas. You don't want them to know that you had anything done.
Phenomenal.
So we put in 7 vials of filler, okay? And you can see that Sarah doesn't look overdone. She just looks refreshed. She looks very natural. And we're going to give her the big reveal. Let her take a look and see what she thinks. So what do you think?
I think I look amazing. I'm gonna take myself out. I'm excited.
And then animate and smile and take a look.
Yeah.
Okay? Look in the mirror. And
It's
see,
really, it's just
notice.
shock.
And that's a nice thing about these
Yeah.
RHA fillers, is that they move with you and they make you look natural, and they keep you looking natural rather than sitting like a lump of coal in your in your face. So those of you who stay to the end of this event, we will be giving away 2 free vials of filler in combination with our 2 most popular cosmetic products, the vitamin C brightening serum and the hyaluronic acid serum. We will be contacting you by email to announce the winner. In addition, all of you that are still present are eligible for $200 off 2 vials of filler when you schedule your appointment before the end of January.